Hi, this is Dr. Grande. I hope you find this video useful. If that's the case, please like it and subscribe to my channel. And as always, thanks for watching. What's it mean? So I'm working on getting at these beliefs.
Okay.
Let's take a look at automatic thought of someone's in your house, right? And let's look at the meaning. So what is that? When you have the automatic thought, someone's in my house right now. What does that mean to you?
You mean like what does it mean, like about me, or what does it mean?
Yeah, what does it mean? Yeah, exactly. What does it mean about you? What does it mean to you in your life? At kind of a deep level. What is the meaning behind that?
I would say that if someone's in my house, then my stuff isn't safer. Like, I'm not safe.
Oh, good. I mean,
like,
good that you identify the belief.
people can just take what they want,
Yeah.
and then I can't do anything.
Okay, so people can take what they want, and I can't do anything.
Yeah, like helpless.
Helpless.
Yeah.
Right. So it's good that you can identify these things. It's very good. So people can take what they want.
Yeah.
I'm helpless.
Yeah.
That's what it means if somebody can just walk into your house.
Right, exactly. Like my stuff's not safe, I'm not safe.
I'm not safe. Yeah. So the automatic thought might be, there's somebody in my house right now. But what you believe kind of at a deeper level than that, or another level of thinking,
Yeah.
is I'm not safe.
Yeah, exactly.
And that belief could combine with other situations and give rise to other thoughts.
Okay.
Right? So ultimately, we want to be able to attack, challenge that belief too.
Okay.
Right? And evaluate it.
Yeah.
So as cognitive therapists, we're always looking to critically evaluate evidence. Right?
Okay.
What evidence supports that you are not safe? Obviously, the car being stolen. I
Right.
understand. but more than that, is there any other evidence that supports this belief that you're not safe?
I would say one thing that's been going through my mind is that because the person who did it lives in my neighborhood, that they're right there, that they could do it again. You know what I mean?
Mm-hmm.
So that they could do it again, and because they live right there, like I know this person.
And that's true, right? They're not in jail or
Right.
prison or anything, and they did it before.
Right.
So you're right. That is evidence that supports that you are not safe. Anything else? So this person being kind of free, and having done that before, that's one piece.
Besides the fact that it did happen to me, when my car was stolen, there's really not too much else. Like you were saying before, it hasn't happened before. Like I haven't been kind of like robbed in that way before in my life, and certainly not in my neighborhood.
All right, so there's some evidence that you're not safe.
Right.
But it also sounds like from what you're saying, you're finding evidence that that's not true, that actually you are somewhat safe.
Yeah, like now that I'm thinking about it and kind of, since the beginning of the session, talking about evidence, we did, like you said, take measures to do things so that we were safe, and it hasn't happened before. It was kind of like an isolated incident, so... But, like I said, I feel very unsafe in the moment.
Right, so you feel unsafe, and there's certainly evidence to support that you are unsafe.
Right.
But there's also a lot of evidence to support that you're relatively safe.
Yeah, I think so.
At some point it becomes a debate between what's useful and not useful.
In my head. Yeah.
Right, yeah. So, which way of thinking is going to lead to a more productive, happier life.
Yes.
Right? Focusing on those pieces of evidence that support that you're not safe, even though they're very limited, or focusing on the evidence that you're actually fairly safe.
Yeah.
And that's just something really, that's not so much you need to answer is right or wrong, but just something to think about.
Yeah.
We like to think of utility.
And I think it's hard sometimes, too, that depending on my mood and what's in a situation, I'm more inclined to believe, like you said, more powerful thought, even though there's not a lot of evidence.
Mm-hmm.
But when I'm calm, I can, rationally think, there's more evidence to support this than this. But it depends on what's going on, which one I kind of pull. I'll want to believe the evidence that supports what I'm thinking.
Right, in the moment.
Yeah, in the moment.
Yeah.